Now, the pulse cardiac test you offer today, you have the antibody test. What part of that is the expanded lipid profile? This is a third test. How does this work into the other two tests that happen?
Right. Well, this is the Heart Month for the American Heart Association, and in conjunction with that, we know that there are at least 250 different causes of increased risk of heart disease and stroke. And they're things like if you have an autoimmune disease, or if you've been bitten by a tick and have an infection from tick-borne diseases, or if you've had COVID, or if you live in a city, if you're under tremendous stress. And we know that since COVID is one of those factors, and since first responders, like EMTs, police, firemen, doctors, nurses, whatever, they have a significantly higher risk of heart attacks and strokes. We thought in conjunction with the testing here that we would offer the pulse cardiac test to first responders through the GUARDaHEART Foundation, which is a not-for-profit. Predictive Health Diagnostics company developed the test and has donated a number of those, I think over 250, to the GUARDaHEART Foundation for use here today. But what we recommend in conjunction with that is that you get something called an expanded lipid profile. And the reason for that is we know that high levels of cholesterol in your blood are one of the risk factors for cardiac disease. They're not the only one. They're just one of those 250. But they're easily modified through diet, exercise, lifestyle, and medications. So we like to cover all of our bases. We want to give you the ones that we can modify easily and get those in the coop. And then we also want to have the pulse cardiac test to tell us what your residual risk in the next 5 years is for having a heart attack or stroke.
Within the expanded lipid profile, it's testing cholesterol mainly, but we have LDL direct, HDL, triglycerides, SdlC. Between all those numbers, what's the ones we need to look for?
So the LDL is the one that's followed for treatment by statins. We look to see that gets lowered. But interestingly, the most dangerous component of that is the SdlDL. That's the smallest form of bad cholesterol. And the reason we like that one is because, number one, the things that make it go up are too much sugar, too many refined carbs like white rice, white bread, excess alcohol, and deep fried foods or excess omega-6 oils like soybean oil, canola oil, those sorts of things. Again, I have people come in to me all the time and say, Doc, I eat right, I do everything correct, and I look at that SdlDL and it's in the 30s, and I go, there's no way you're eating correctly. You're going to Starbucks too frequently and getting one of those caramel macchiatos with 80 grams of sugar, which is 20 teaspoons of sugar in it. So one of the things that we've learned recently is that things like triglycerides and VLDL are increasingly important. They may actually be better predictors of cardiac risk from the lipid side than LDL cholesterol. And so right now there have been several papers looking at VLDL, which is very low density lipoprotein. That's what it stands for. It's kind of big and fluffy. And what that means is that if you put that in conjunction with triglycerides, which used to be ignored, and what's called remnant cholesterol, I think we have a better handle on how to assess your risk, because LDL is definitely not the whole story. And this is all breaking news. This has all recently been revisited. So we're now focusing on people with high VLDLs and triglycerides because they're kind of related, and also with the SdlDL, because we can modify those fairly quickly.
Also on that panel, we see the hsCRP. There's a number on that as well.
Right. hsCRP is a non-specific acute inflammatory marker, and we use that because it'll tell us if you've got some ongoing inflammation in the rest of your body, not necessarily from the heart. hsCRP comes from the liver, but it's called an acute phase reactant. So if you have dental problems, or if you have arthritis, or if you have a bladder infection or an early viral infection, usually CRP goes up. And we use that just to gauge your level of health, and it's kind of a contributing factor. We also do something called Lp(a). Okay. Now, most people haven't been testing for Lp(a), but it turns out that Lp(a) is genetically determined. It doesn't respond well to drugs or therapy except for It's called Repatha. It's a way of super lowering your cholesterol. And it confers an independent risk of heart attacks and strokes on individuals that have a level above 50, although it's abnormal above 30. And we're surprised at the number of people who didn't know they had Lp(a). They really need to be aware of it, because by modifying your lifestyle and living a healthy lifestyle, you can mitigate a lot of that risk. But if you don't know about it and you think you can party like Chris Farley, then you're going to create a lot of problems for yourself.